Our Lady of Fatima University. For today's video, I'll be showing on how to transfer patient bed to chair, chair to bed. So this purpose of this procedure is to promote comfort and change the patient's position, to prevent complications of prolonged bed rest such as pressure injuries and muscle weakness, to maintain muscle strength and joint flexibility, and to promote patient safety during movement and transfers. So first, we check the patient's medical record that may affect movement or positioning. Look for tube, IV lines, incision, or any equipment that could make moving the patient more difficult. Identify any movement restriction and follow the patient's handling guidelines. So we're gonna perform hand hygiene first and put on PPE to prevent any spread of microorganisms. Now we're gonna identify the patients and explain the procedure to the patient. Ma'am, can I see your wristband, please? Can you please state your full name and date of birth?
Angelica Henao, September 12, 1995.
Okay, thank you. So ma'am, I will help you move from your bed to chair and chair to bed. So this will help comfortably and improve your circulation and prevent complication from staying in bed for too long. If needed, move the equipment to make room for the chair. Close curtains around bed and close the door to the room if possible. So ma'am, I'm gonna close for your privacy. Use the curtain. And then place the bed on the lowest position, and then raise the head of the bed to the sitting position of as high as the patient can tolerate. Then make sure the bed brakes are locked and also the chair next to the bed. If available, lock the brakes of the chair. If the chair does not have brakes, brace the chair against the secure object. Then encourage the patient to make use of a stand assist aid, either freestanding or attached to the side of the bed. If available, to move to the side of the bed and to a side lying position, facing the side of the bed on which the patient will sit. Then lower the side rail, if necessary, and stand near the patient's hip, standing with legs shoulder width apart with one foot near the head of the bed, slightly in front of the other foot. Then encourage the patient to make use of the stand assist device. Assist the patient to sit up on the side of the bed, then ask the patient to swing his or her legs over the side of the bed. At the same time, pivot on your back leg to lift the patient trunk and shoulders. Keep your back straight, avoid twisting. Stand in front of the patient and assess for any balance problem or complaint of dizziness. Allow the patient legs to dangle a few minutes before continuing. Then assist the patient to put drop or necessary or put step. Then now can you move up? And then rub the gait belt. I'm gonna put your gait belt. Then, wrap the gait belt around the patient's waist based on the assessment need and facility policy. Then I'm going to stand the patient, facing the patient, and spread the legs, feet about the shoulder width apart, and flex your hips and knees. Then I'm going to ask the patient to slide to the edge of the bed until the feet touch the floor. Position yourself as close possible to the patient. Then using the gait belt, assist the patient to stand. Then at the count of 1 to 3, raise the patient to standing position. Then 1, 2, 3, raise, careful, pause, use the chair. Then ask the patient to use an arm to steady him or herself on the arm of the chair while slowly lowering to the sitting position. Brace the patient's knees with your knees and hold the gait belt. Flex your hips, knees when helping the patient sit in the chair. Then adjust the patient's alignment in the chair. Then I'm gonna remove the gait belt and cover with a blanket if needed. And also for the patient's privacy. And make sure call bell and other necessary items are with easy to reach. Then I'm gonna clean the clean belt. Indicates for the single patient use. And then I'm gonna remove the gloves. I'm gonna remove the gloves and any PPE if used. And then perform hand hygiene. Then we're gonna transfer the patient from chair to bed with the same procedure. So ma'am, I'm gonna transfer you on your bed po. Then put your gait belt. So ma'am, can you hold me? Then I'm gonna transfer you na po. 1, 2, 3. Okay, careful. Slowly lang. Then remove the gait belt. Also the footwear. And help the patient again.